when you look at so-called non-communicable diseases, the growing epidemics of cardiovascular disease, diabetes, cancer around the world, some of those medicines are not available in generic forms yet. And we have to hope, I think, that in cancer, for example, there will be many innovative new treatments which are not going to be available in generic form for 20 years. I mean, we desperately need new cancer treatments. We've had a bit of a shortage of them over the past 20 years. But it does now seem as if a new stream of them will be coming on. So for those sort of non-communicable diseases, there really is a question of access to medicine.
And you were saying earlier that there is a sort of alliance between the generics manufacturers in the middle-income countries and NGOs and some of the poorer countries cooperating with them to argue for particular drug regimes.
Or to argue that the intellectual property, remember I said earlier that when let's say company A discovers a medicine, they'll typically have 15-20 years of patent life on that medicine, in which time they can recover their research costs and make a profit. So there is a very loud coalition of NGOs, middle-income countries and some of the least developed countries who are saying that that intellectual property scheme should only apply in North America and Western Europe, effectively. And effectively their argument is that all medicines should immediately be available
outside of that area.
Made by generic manufacturers outside of that area.
And your argument is that the middle-income countries can and should afford healthcare costs, and a country like Brazil is perhaps not paying what it should do for healthcare.
Well, I think that is right. I think it sounds good on the face of it, until you look at what the effect might be on innovation. That as Western Europe and North America shrink as a part of the global economy, the Australian Prime Minister recently said that the global economy the center of the global economy shifts eastward at a rate of about 100 miles a year. So as Western Europe and North America decrease as part of the global economy, the ability of companies to recover all of their research costs and to make a profit from these shrinking markets is increasingly remote. The danger then would be that there wouldn't be incentives for innovation, you wouldn't have any new medicines coming along. And as you say, if you look at some of the richer actually some of the poorer and the richer middle-income countries, we traditionally split the middle-income countries into lower and upper middle-income countries. If you look at an upper middle-income country like Brazil, which has a per capita GDP, if I remember, of about $12,000 a year, so-called purchasing power, parity GDP, about $12,000 a year. It's actually sort of in the same band as the poorest members of the European Union. Yet Brazil, absolutely democratic country, chooses to spend far less on health than Europe or North America. So
you were saying that the figure was
4 or 5% of GDP, I think. Against 12-15% of GDP, even higher in the case of the US. So I think Brazil has made the decision not to spend much on health. In a democracy, that's a perfectly legitimate decision to make. Even more radical if you look at India, for example. India, a lower middle income country with a per capita GDP of, I forget, 1,300, 1,400. There, it's something like 2.7% of GDP is spent on health, and 85% of that is in the private sector. So the state has really opted out of providing healthcare. Most kinds of healthcare.
Yeah.
Now, in a democracy, we certainly can't second guess what the people in their sovereign majesty decide to do, but it's not a basis for arguing that they should then have unlimited access to cheap medicine.